I'm Sarah Milosevic and I'm a Qualitative Research Associate at the Centre for Trials Research at Cardiff University. I'm going to talk about the qualitative work we've carried out as part of the PRIMUS study and present some key findings. The reason for the PRIMUS study is that currently GPs don't have access to simple tools to accurately diagnose the cause of lower urinary tract symptoms in men. These are symptoms such as needing to urinate frequently, having a slow stream of urine, or waking in the night to urinate. They affect a large number of older men and can have a big impact on quality of life. The PRIMUS study aims to create a clinical decision support tool to guide GPs in the diagnosis and treatment of these symptoms. The tool will enable more men to be treated in primary care, which can benefit patients and generate cost savings for the NHS. The study is recruiting men who present to their GP with one or more bothersome lower urinary tract symptoms. These men are being recruited from around 90 GP practices across Newcastle, South Wales and Bristol. As part of the study, participants undergo an invasive urodynamic procedure. This is a gold standard test for investigating the causes of lower urinary tract symptoms and involves inserting catheters into the bladder and rectum to measure bladder function. The urodynamic test is usually carried out in secondary care by specialist practitioners, but for the PRIMUS study it's being carried out by trained research nurses in primary care settings such as GP surgeries. Because the urodynamic test is invasive and it's being carried out in a different setting to usual, we needed to assess whether PRIMUS study procedures were acceptable to patients in the pilot phase of the study before we could carry on to the main phase of study recruitment. So to do this, we carried out a qualitative acceptability study. The aim of this qualitative study was to explore patient views of taking part in the main PRIMUS study and particularly receiving the urodynamic test. We did also interview health professionals involved in the study to investigate the feasibility of conducting the urodynamic test in primary care, but in this presentation I'm just going to focus on findings related to patient experiences. We conducted 22 semi-structured telephone interviews with PRIMUS study participants, and we also conducted 3 interviews with patients who had declined to take part in the main study. In the interviews, we asked participants about their decision to take part or not take part in the study, any concerns they had, and how they thought we could encourage other patients to participate. Those who had taken part in the main study were asked about their experience of study processes and specifically the urodynamic test. All of the interviews are audio recorded with the permission of participants and transcribed verbatim, and we carried out framework analysis of the interview data to identify key themes. I'm now going to talk you through some of our key findings, firstly in relation to experiences of the urodynamic test, and secondly in relation to participants' reasons for taking part in the study. A key finding was that all of those we spoke to who had received urodynamics said that they found the procedure acceptable. Around half of them said they felt some discomfort, but described this as being only brief or mild. Some participants said they felt apprehensive or embarrassed about the test, but most found it was as they'd expected or better than they'd expected. A key factor in patient acceptability was the way that the nurses carried out the procedure. Participants were generally pleased with the way urodynamics was explained before and during the test, and said that nurses made them feel at ease and as comfortable as possible. As I said earlier, the urodynamic test took place in primary care settings such as GP surgeries rather than in hospital. Participants were really positive about this, and some said that this made them feel much more relaxed about having the procedure because they had full confidence in their GP surgery and were familiar with the staff. Another factor was convenience in terms of reduced waiting and travel time and ease of parking. Patients identified that being able to have a thorough investigation of their symptoms without a long wait was a key factor in their decision to take part. Another common reason for participation was the opportunity to contribute to research that has the potential to improve medical practice and benefit others in the future. Some patients specifically wanted to help raise the profile of lower urinary tract symptoms in men, and others wanted to participate to help their own GP surgery, particularly where they had built up a good relationship with their GP. Patients who opted not to take part said this was mainly because they did not want to have an invasive test. Some also mistakenly believed they would have to go to hospital as part of the study. For those who did take part, they appreciated that the research could take place at a local surgery. Patients made a number of suggestions as to how we could improve study recruitment. For example, they suggested that health professionals should emphasise that study participants would get quick access to a thorough assessment of their symptoms without needing to go to hospital. They recommended that patients should be given extra reassurance about the urodynamic test. For example, health professionals could explain that most men who experience the test find it acceptable. Patients also suggested that having the study recommended by a familiar GP could encourage others to take part. So in conclusion, interview findings demonstrated that study procedures, including the invasive urodynamic test, were acceptable to patients and therefore that we could continue to the main phase of the study. Facilitating study procedures in primary care can have a positive impact on research recruitment, as patients generally prefer to attend a familiar and more convenient setting. More widely, conducting urodynamics in primary care settings has the potential to benefit patients and increase uptake of the test outside of the primary study.